Well, hello, future nurses. In our hopes of trying to finish chapter 21, I'm going to try and do a little bit of podcasting. So our subject here is Candida species. This is the country to the north that makes maple syrup. This is Candida. This organism is a eukaryote. It grows as a budding yeast. The species that you will experience most often is Candida albicans. Other species are becoming more prevalent, and many of these species are resistant to some of the common drugs used to treat Candida albicans infections. This organism is an opportunistic pathogen. It normally survives on your skin, and it colonizes your mucous membranes, and it will have a tendency to overgrow under certain conditions. And to show you essentially what the organism looks like, so here is a sputum sample from a person with bronchitis that was caused by Candida albicans. You can see the yeast-like structures here. When the organism invades the body, it will make these filamentous structures called pseudohyphae. And those pseudohyphae will be used to penetrate further into the body. And those pseudohyphae are only made when the organism grows in tissue. If you try to make pseudohyphae, you need special culture conditions if you're culturing it. Here are the budding yeast cells actually germinating. If you grow them in serum, this is the electron microscope. Here's what it looks like in the light microscope. You put them in horse serum, and they will make these little germ tubes, as they're called. What are the risk factors of this organism normally in your skin and mucous membranes? First of all, it's not a sexually transmitted infection. It's an opportunistic infection. So risk factors include prior antibiotic treatments, so fewer normal flora organisms growing on your skin and mucous membranes. You have less competitive exclusion, so now Candida will overgrow. Cigarette smoking, because it interferes with the growth of normal flora. This will also predispose you to Candida infections of the mouth, so-called oral thrush. Tobacco use in general. So chewing tobacco or cigars will do this. Some might be wondering about vaping. There's not a lot of data on vaping. I would imagine vaping increases the risk, but there's just not much data on that yet. Also, immunosuppressive conditions. So this would include things like diabetes mellitus, type 1 or type 2, HIV, cancer, inherited immunodeficiencies, also certain drugs that suppress the immune system like steroids, and certain treatments such as radiotherapy or chemotherapy. They will suppress the immune system. They will also cause a greater risk of acquiring Candida infections. So Candida can cause oral thrush. This is an HIV patient with oral thrush. The organism kind of looks like cottage cheese as it colonizes the gingiva mucosa. The yeast can be cultured from this curd-like growth You also get the same curd-like growth in the vaginal tract. This is also a HIV patient with vulvovaginal candidiasis. This is a so-called yeast infection. You'll see this also in women where the pH of the birth canal has been raised, usually by use of birth control pills. So this will cause, again, a curd-like discharge. You'll have vaginal itching, as well as pain during urination, so-called dysuria. In babies, you'll get a diaper rash that causes a generalized red rash surrounded by scattered red spots that are called satellite lesions because they look like tiny red satellites that are not contiguous with the rest of the rash. Here's another picture, essentially, of Candida vulvovaginitis. This is more black and white, but you can see the redness that spreads also to the insides of the legs. It can cause an inflammation of the penis in males. This is called ballantitis. You won't be able to culture the yeast from these lesions, however. This might be due to an allergic reaction from the yeast antigens as well. This organism can also cause an esophagitis, and it also will infect prosthetic devices, and catheters, like central venous catheters. And these yeast-laden biofilms that form on these devices, these yeast can break off. They can also infect the heart valves. They can also infect the liver and the spleen, bones, joints, kidneys. They can also cause meningitis. And they can infect the eyes as well. To diagnose this, the organism is pretty easily cultured. You can grow it on a glucose yeast extract type of medium. There's a medium called Goratkua agar. Goratkua agar grows Candida quite well. There are antigen tests that detect beta-D-glucan from the cell walls of Candida. These work very well. Also, PCR tests detect Candida DNA. These work quite well also. Now, to treat Candida infection, so oral thrush, you treat with a nystatin suspension. It's 100,000 units per mil. You treat for 7 to 10 days, 4 times a day QID. You swish and then you swallow. This stuff doesn't taste very nice, so patients may want to swish and spit, but don't. They need to swish and swallow. There are also nystatin troches, 10 mg, and you use those 4 times a day as well. For moderate to severe oral disease, you use oral fluconazole. You treat for 7 to 12 days. You treat for 200 mg the first day, and then the next 13 days, you treat with 100 mg, 7 to 14 days. And then for intractable disease, refractory disease, you either use itraconazole, 200 milligrams every day. Make sure they take it without food. Food disrupts the absorption of itraconazole. Or posaconazole, 400 mg, twice a day for 3 days, and then the following days, just once a day, 400 mg. Or you can use voriconazole, 200 milligrams twice a day. And often, for refractory disease, you may have to treat for up to 28 days. For children, you can use nystatin suspensions, but there are also clotrimazole troches. Troches present a choking risk for children under the age of 4, so only use them for kids older than 4. These are 10 milligrams. Use them 5 times a day. Try to get the kid to not chew them. For infants less than 30 days old, use a half a mil of nystatin, half a mil each side of the mouth 4 times a day. If they're older than 30 days old, you then use a mil each side of the mouth 4 times a day. Normally, candidiasis will clear up in 3 to 4 days. You discontinue treatment 2 days after the lesions disappear. For vulvovaginitis, there are very good over-the-counter medicines. People don't tend to use them properly, but you should use them as directed. So there's clotrimazole creams. There's a 1% and 2%. You apply these at night. 1% you apply for 7 nights. 2% you apply for 3 nights. There's a miconazole cream, 2 and 4%, 2% you treat for 7 nights, 4% for 3 nights. There's also miconazole suppositories, 100 and 200 milligrams. 100 milligrams you use for 7 nights, 200 milligrams you use for 3 nights. And then there's thiaconazole ointment, 6.5%. That's just a one-off. If these don't work, your prescription drugs include nystatin vaginal tablets. You use those for 14 nights. There's teraconazole suppositories. You use those for 3 nights. There's also a cream that you use for 3 nights. There's also butaconazole cream, 2%. That's a one-off, but you don't use that during the first trimester of pregnancy. Oral medications, 150 milligrams of fluconazole. And if symptoms persist, you can repeat that after 72 hours. There is an up-and-coming pathogen called Candida auris. You're seeing it more and more in hospitals. It is resistant to fluconazole. So you'll treat that with echinocandins like micafungin or andalafunkin or something like that. Very good. So to sum up, Candida is an opportunistic yeast-like fungus. It can overgrow in situations where there's very high glucose concentrations or fewer competitive microorganisms or a weakened immune system. Common sites of infection include the mouth, the esophagus, the vulvovaginal system, and the growing in infants. It can cause disseminated disease. That's usually only in people with a weakened immune system. Severe infections include those where a biofilm forms over a prosthetic device or implant, and this requires the removal of the implant or prosthetic device from the infected site.